Today we are so happy to have Dr. Jaclyn Moore. She's the CEO, co-founder of Big Island Grown here on the Big Island to share with us on medical marijuana. As mentioned earlier, Dr. Withy is having some plane delays over in Pohnpei and Guam, so she will not be here. We have Dr. Alicata, our co-director, with us today. Between he and I, we will help to facilitate the chat. And without further ado, I'd like to hand it over to Dr. Moore.
Thank you so much. Thank you very much. And I just want to say it is an absolute pleasure to join you all today. Thank you so much for the invitation. I'm very passionate about this subject matter. I was fortunate enough to be a part of the application phase when the state opened up for medical cannabis licensees for the dispensary system. And I'm happy to be here to share my experience and what I know and understand as a licensed healthcare provider in the state of Hawaii. So what I'd like to do is start off with a video. I understand that there's some branding associated with this video, and I am presenting very fair and balanced information. So please just take from this the level of standard execution and professionalism based on the state law and administrative rules, the way it was written. I think this is one of the best ways that we have found to acclimate providers to what's happening here in the state with medical cannabis, and it's through a tour. And because I can't have each one of you come through the building right now, I feel like this is the next best thing. So with that, I'd love to launch right into the video.
Cannabis is just such an amazing plant. It's so rich in cannabinoids and terpenes.
If you look,
I think the video is not playing. It started for a little bit and then stopped.
So it's not coming across clean.
It looks like it's buffering now.
Interesting. Okay.
spectrum,
From pain to anxiety to sleep.
they had PTSD or they had cancer. It seemed to help everybody pretty consistently. I actually saw
Yeah, the sound keeps going on and off. Sorry.
I'm wondering if I should just launch into the presentation. My sincerest apologies for the video not working the way it should.
No worries. And if you send me that link, we can give the link out to our participants on the website so they can go ahead and watch it later.
Love it. Okay, so let's just launch right in. So thank you all again for your time and attention. My name is Jaclyn Moore, PharmD, CEO and co-founder of Big Island Grown Dispensaries. The topic today is really evaluating medical cannabis in Hawaii and what that means.
Sorry, Dr. Moore, it's not coming up for us.
I'm so sorry about this.
No, it's okay. If you want to email it to me real quick, I can share the slides for you.
It's up now.
That's the video.
Okay.
There we go.
Okay,
Now we-
good. Gotcha. Why is this not loading? I'm so sorry.
It's okay. We still have people joining in, so.
So I'm gonna disconnect and then connect again, and in the meantime, send you the link to the video.
Okay, great.
Thank you.
Are you hearing it?
Cannabis is just such an amazing plant. It's so rich in cannabinoids and terpenes.
If you look back before 100 years ago, cannabis wasn't frowned upon. It was used in hundreds of different medicinal compounds.
I don't think there's any other medicine out there that helps such a broad spectrum.
From pain to anxiety to sleep.
They had PTSD or they had cancer. It seemed to help everybody pretty consistently. They actually saw a child with epilepsy and how quickly the epileptic seizures ceased from ingesting cannabinoids. That just further confirmed of how powerful this medicine is. We're all in the same mindset. Everyone that works at Big Island Grounds, like, I love cannabis. We're very passionate about the plant. That creates a very efficient, successful team.
This collective mission of what we're doing is so much bigger than one person. It's about putting this energy into the plant, into the medicine.
We're all passionate about the same thing, and it's providing high quality medicine that are going to make people better.
We take a lot of steps to make sure that there's without a doubt, a clean, exceptional end product.
The mission of Big Island Grown is to perpetuate the proud legacy of Hawaii farmers through growing and crafting the highest grade cannabis medicine in the world. We're here at our production facility in Pepe'ekeo, located on the Hamakua coast on Big Island. And what you see is a building that we built from the ground up. The facility is a 35,000 square foot, completely controlled environment, indoor grow. This building is fed with fresh Mauna Kea spring water. We are blessed to have Waia'ama Stream as an input for our facility here. We are one of the only facilities that uses both hydroelectric and solar to power our indoor grow.
All of this water coming into our building is from a Mauna Kea spring that is then treated with reverse osmosis and then fed to all of our plants. Whether it's the positive air pressure, the HEPA filtration, the thermal buffer zone, adjusting the temperature differential between zones in the room, the filtration of water from the volcanic spring, all these different factors, it's purpose-built. It's purpose-built to grow the best cannabis in the world. Currently, we are in the mother veg. So this is where everything gets started. This is where we do all of our seed popping, our pheno hunting, keep all of our production mothers around, do all of our cloning to supply our rooms as we go. We're going to clone all these different parts of this mother. We find the mom that suits our needs. And then from there, we take clones. So we end up with an exact replica that we can send to our flower rooms and get a really consistent quality end product that's very similar to that original mom. We never use any herbicides, pesticides, fungicides, anything like that. Nothing ever gets sprayed on our plants. Once they go into the flower rooms, we start the bud process. We start feeding them heavily. And after that 9 weeks, we do a full plant harvest. For harvesting, we're just basically mimicking fall, winter. So it's going to be dry and it's going to be cold. It gets that really nice weight, really crystals out, really nice bud structure, just like nature does, but more optimized. Free barcode is weighed with the plant that it represents. Those full plants get hung. We do a full plant hang for approximately about 10 days. After day 10, we then start to remove the flowers from the stems. We start the curing process. It then moves to the vault, which is our humidity, AC controlled environment that we store all of our product in to make sure that everything's homogenized. It's nice and dry and consistent throughout the bucket.
Everything that's available at Big Island Ground that is not sold in raw flower form is produced in this room. So we'll get a variety of, fresh frozen plants. We'll get a lot of trim, and then we'll be able to actually harvest the cannabinoids and terpenes from that raw material and produce, a vast array of different end products. We have distillate cartridges, live resin cartridges with our hydrocarbon BHO extraction.
Pushing very, very cold, negative 60 degrees Celsius, hydrocarbon gas through that column, whether it's frozen cannabis material, it's like lock and key, grabs the best parts of the cannabis plant, the trichomes, the cannabinoids, pulls it right down. And that's why you have such high grade, close to 100% cannabinoids and terpenes in our extracts.
Do fractional distillation here. What we're doing there is we're producing a fairly crude cannabis oil that we then distill multiple times to really refine and increase the quality and potency. We'll actually take that oil and recombine it then with our steam distilled terpenes to create an end product. We have a massive variety of both soft and hard lozenges, aim to produce it all at a really high quality so patients can figure out what works for them.
This is the hub of the production center. This is where all the cannabis is trimmed, processed, and packaged, as well as all the extraction and the cart filling and anything to do with the actual logistics and processing of our cannabis and cannabis medicine to our stores. One of our main missions was to create a place that patients or cannabis users could come to because they want to come and not because they need to come.
Welcome. We are at our flagship location here in Kilo. We have 3 retail locations, one in Hilo, one in Waimea, and one in Kona.
To offer a place that people can come and know that they're getting clean, quality medicine, I think it's critical. It's huge. It's what was needed for the patient.
What happened is that you had 17 years of patients that did not have legal infrastructure and access to clean, tested cannabis. It's about having patients come in with confidence.
Dispensaries, we offer infrastructure and we offer consistency. There's a lot of patients that don't have a good source or can't grow the medicine themselves. We offer a consistent place. We always have options. It's tested, it's quality, and it's available.
There's definitely more of a journey using cannabis as medicine, but I think that the potential increase in quality of life and overall health outcomes are definitely worth the ride.
Reached this tipping point where we are normalizing plant-based medicine. And there's no better place to experience this than Hawaii and Big Island, where La'au Lapa'au and Hawaii plant-based therapeutics have been around for generations.
Come check us out. We're here to talk and we're here to listen.
If we can better the health outcomes of our, friends, family, and neighbors on the Big Island, then, we're doing our job right.
We are here to serve you and to provide the highest grade quality cannabis medicine so that you can live your best life.
Thank you, Summer. And if you wouldn't mind switching to the slides, I'd love to just kind of frame out what everyone watched. Like I said, I understand that it was more brand specific, but really the takeaways that I wanted you all to experience was, taking a tour of the facility and understanding at least our interpretation of the requirements from a dispensary system and what it would take to produce medicine in this state that would pass lab testing standards or full compliance testing. And we'll get more into that. I did want to just frame this out so that everyone has a big picture of the dispensary system here in Hawaii. So right now, patients have been allowed to grow up to 10 plants for themselves. And for those that require assistance, they are allowed to have a caregiver who grows on their behalf. This has been a trusted source of cannabis medicine for patients for many, many years. As I stated in the video, There were at least 15 to 17 years since the medical law was passed, allowing patients to consume and have medical use of cannabis back in 2000 to the time where legal infrastructure was actually erected for patients to actually be able to frequent a location. So there's multiple ways to access medical cannabis in the state. I wouldn't say one is any better than the other. The requirements for each, I would say, are different. When you have patients growing or caregivers growing for patients, it's really kind of an opt-in situation with respect to testing. But again, with familiar sources, this has been a trusted, access point for patients for many, many years. And what I'm here to speak about today is more specifically the dispensary system and the expectations and regulatory environment that we operate in, so that as providers, you have a better sense of what medical cannabis looks like in the state being accessed through the dispensary system. So our main topics for today are really going to be exploring medical cannabis and its definition, an overview of the endocannabinoid system, which is really the basis for why cannabinoids and terpenes work in your body, an overview
I think we lost your connection, Dr. Moore. Hi, Dr. Moore, can you hear us? She must be in an area with low internet connectivity. She just signed off, so she'll probably be joining us again. And I think Renata, that's why she has her camera off, so that her connectivity can be a little stronger. There she is.
Apparently, we're having power outage and connectivity issues at the farm today, so forgive me.
You're back.
May I bother you to go back up to the table of contents, please?
Sure.
Thank you.
Oh, okay.
So what I was talking about is the reclassification, potential reclassification and recommendation from HHS to the DEA. And if accepted, it means cannabis would be reclassified to a C3. There are various implications to this. One of the most profound would be on research, and that's where we know there's the biggest, I'd say, deficit, at least in this country, is for research. There would be banking implications and implications to a tax provision called 280E, which is more of an operational implication that doesn't affect patients as much. And then intrastate commerce would be something else that would be explored if HHS recommendation to DEA is in fact accepted. Next slide, please. Brief overview of the endocannabinoid system. So the ECS, or the endocannabinoid system, is the most widespread receptor system in the human body. This is comprised of G-coupled protein receptors, both CV1 and CV2 receptors. There are also other prevalent receptor systems, but CV1 and CV2 are the most widely known and have the most research surrounding those. The function is to regulate the flow of signals that are being sent between cells with the goal of maintaining balance or homeostasis. Endocannabinoids are made and released on demand by our cells in response to a trigger such as illness, injury, or inflammation. It regulates important physiological pathways in the body, including GI and cardiovascular activity, pain perception, metabolism, immune function, inflammatory reactions, modulation of neurotransmitter release, protection of neurons, and inhibition of tumor cells. So as stated in the video, medical cannabis is a therapeutic journey that is specific to each patient. A patient really has to go through this process of finding what works and does not work for them based on the state of their endocannabinoid system, and also the various products that are available with respect to cannabinoid and terpene prevalence. There are certain basic tenets that as providers that we should always be mindful of, and that is start low and go slow, really suggesting and encouraging patients to document their effects per each product and strain. And really microdosing has become a very popular way of consuming and starting your patient's cannabis journey, especially if they are cannabis naive. This is the way that we can encourage patients to navigate through this experience responsibly. Next slide. Hawaii State has various qualifying conditions. Of them, you have cancer. Probably the most prevalent when we're looking at registered patients is severe pain, seizures, Crohn's disease, PTSD. There's a host of conditions, and there's also conditions that are not listed here that could be approved by the Department of Health by request by a patient's provider. Next slide, please. The way recommendation of cannabis works in this state, a provider certifies a patient for cannabis use, and that's typically through a physician or advanced practitioner, registered nurse. So what they do is they diagnose the patient as having a debilitating medical condition covered under the current medical cannabis law. During this interaction, potential risks and benefits of the use of cannabis per the patient there's an exchange where through medical records and through this dialogue between a patient and their certifying provider, there's a clear understanding of risks and benefits, and I would say side effect profiles and the consideration of other medications that they're on. A provider certifies in writing that in his or her professional opinion, and having completed a full assessment, that the patient has potential benefits of the use that clearly outweigh these risks. So right now there's approximately 400 providers that are certifying patients as of September 2023. Medical cannabis is not required to conform to the prescription monitoring program, similar to the way other controlled medications are recorded in the state. Many patients we encounter have been hesitant to disclose that they are patients to their current providers. So I want to pause right now to make the distinction that a certifying provider may or may not be a patient's primary care provider. And in instances where they are not the same practitioner, we have encountered patients that are hesitant and somewhat fearful to disclose that they are medical cannabis patients to their primary care providers for a host of different reasons. As we begin to normalize this in the healthcare industry here, I think that this will become less of an issue in full disclosure. This is especially important when somebody goes into the hospital and people are reconciling, or practitioners are doing a medication reconciliation. You definitely want to have a patient be able to fully disclose that they are a 329 patient consuming cannabis, and be able to understand specifically what products they're using and for what indication. What's really important is that there are patients that are not necessarily registered with the state, and this is where there are some complexities. So there are certain cost prohibitions and barriers to becoming a registered patient, and with the ease of access of cannabis now through direct to consumer, you can get certain D8, D9 products, and we'll go into what those are, delivered directly to your home. there are reasons why patients are choosing not to become registered, but for those that are registered, next slide, there's a breakdown of what those patients look like. One moment. Okay. So as of September 2023, there are a little over 32,500 patients registered. What does the Hawaii registered patient profile look like? Well, what we're seeing is about 57% are male, average age of 53. Females are about 42% or 43%, average age of 51. And the most prevalent qualifying conditions are severe pain by far. 83% of patients we're seeing with this indication. PTSD is the second most prevalent at 17%, and then persistent muscle spasms follows. So when you look at the breakdown of the age group, patients 55 years and older are about 43% of the patients. And that's actually a number that I was very surprised to see, especially at first. I think this is a demographic where the larger this percentage gets, we're seeing more of an adoption rate and acceptance of cannabis as a plant-based therapeutics. And if you look at the specific age group of 65 to 75-year-olds, it's close to 19% of registered patients are in this age group. So it becomes even more important to have and understand how the medicine is being grown, what the potency and specificities of the label, what it is, so that patients of this demographic that typically, as you increase in age, you're seeing polypharmacy. So there are other things at play. And we'll go into drug-to-drug interactions towards the end. And even though it's less prevalent with THC, there are some potential drug interactions to note with CBD-based products. Next slide. So Hawaii State requires compliance testing. Now, when I was talking about before how to define medical cannabis, it varies state to state because it's still a C1 federally. The only way to truly define it is with state testing standards and also other state requirements such as GMP standards. And that's not the same state to state. Now, I think it's becoming more in the last, I'd say 3 years, more standardized. There's now an association called CANRA, which is the Cannabis State Regulators Association, where you're getting more discussion and dialogue between states in the hopes of standardizing things like labels and other testing requirements, but it's not quite there yet. So what distinguishes Hawaii State Medical Cannabis Program is really its lab testing standards. So it requires a third-party full compliance testing of all final product prior to dispensing. Labs are required to be ISO certified, and this is a process of, or in the process of becoming ISO certified. So ISO certification is essentially a third-party accreditation of lab methodology and accuracy. This really limits what we saw early on when we started the program here, when we started looking at what was happening in other states. There was this concept of a pay to play, right, with lab testing standards. And so, we saw those in states like Washington, 6-7 years ago. And so now with this ISO accreditation, it even further enhances those standards and limits any kind of, gray area testing that we saw with less regulated states. Compliance testing includes testing for mycotoxins, heavy metals, and residual solvents. Pesticides is something very specific that I want to talk about now. Pesticides and the use of pesticides vary state to state. This is something that a lot of healthcare providers don't realize, that some folks are spraying flower with pesticides. And Hawaii State requires less than 1 part per million as far as a standard level for on a lab test. And so what that means is with all practical, in a practical sense, you can't use pesticides because it would trigger a failure with Hawaii state standards. Back in 2017, there was a study that came out, and it was from Steep Hill in Berkeley. And what they looked at were samples of cannabis that were being tested. And what they found was over 84% of the samples had residual pesticides. More specifically, 65% tested positive for myclobutanol, which is another name of it. Another name is Eagle 20. Now, this pesticide is traditionally sprayed on grapes, almonds, strawberries, and is listed as general use pesticide. The problem with Eagle 20, when you apply it to cannabis flower, is that when you heat it up as a chemical, and as in the case of smoking, cannabis flower, it converts to myclobutanol. Myclobutanol converts to hydrogen cyanide. Now, hydrogen cyanide is a Schedule III substance under the Chemical Weapons Convention. So this is something that is very toxic. And when you're talking about patients and the most fragile of patients, you're talking about folks that have compromised immune systems. And so that is one thing as a healthcare provider here in the state, it's easy to rally behind, and that's the very high testing compliance standards that the state has put forth for products that are going and being sold within the dispensary system. Next slide, please. Now, there are different ways to grow cannabis, and there's not one way that's better than the other, but from the perspective of consistency, I think that there are some notable differences between indoor, greenhouse, and outdoor. So indoor versus greenhouse versus outdoor, these are growing conditions that can affect cannabinoid and terpene expression in its final flower form. And indoor, there's a level of consistency of growing conditions. When you tie technology in with proper environmentals, you are able to monitor, control, and reproduce, even with some slight variability, a very consistent end product from harvest to harvest. Greenhouse structures vary, they vary. You have, right now you have greenhouse structures that are more technologically cutting edge with respect to environmental controls. So from a standpoint of consistency, ideally you want to be able to harness the power of the sun, especially given the solar window here in Hawaii, along with some level of environmental control. Environmental control would be the addition of AC, humidification, or even supplementation with lights when it's particularly cloudy. In the state of Hawaii, outdoor grows are prohibited for dispensaries. Next slide, please. The other thing that sets Hawaii state apart is its incorporation of GMP standards and its labeling and required labeling. So Hawaii state more specifically has incorporated GMP standards associated with the production of edibles. In addition to GMP standards, labeling requirements include potency, weight, concentration of various constituents, ingredient list. There's a barcode so that you can monitor it from the seed down to the end consumer or patient. So God forbid there's ever a drug recall, we know exactly what lot and what cuts it came from, and we are able, with that barcode, to trace it to a patient to be able to enact a drug recall situation. In the 8 years of the program here, I am not aware of one situation where any medication was required to be recalled. In addition, on the label, it discloses the harvest date and the date of manufacture, along with other warnings. Next slide. So the goal is to produce flower with high density trichomes. And this is a beautiful picture, and those crystals that you see are THCA crystals. And typically you want, maximum expression of cannabinoids found in these crystals and trichome heads, along with very robust terpene profiles. Cannabis is one of those medicines that actually is enjoyable for patients. The whole experience from the beginning to the end we're finding patients just based on how they're choosing to consume it, have preferences to that experience. So for example, smoking flower is a very different experience than consuming an edible versus taking a tincture. And there's different reasons why you would consume it differently. A lot of it comes down to patient preference and a level of familiarity, but it's become very, very sophisticated in its formulation and form. So by far, flower sales in this state is still the most prevalent. It's just been around for so long. It's something that's very familiar. And without getting into the construct of, sativa versus indica versus hybrid, I think it's fair to say that all flowers now have been hybridized. So, it's hard to find just a true indica or sativa. And why does that matter? Well, when I'm using the terms indica and sativa, as a provider, I'm looking at the indica-like effects or effects that would be typically associated with an indica dominant strain versus sativa-like effects that would typically be associated with a sativa dominant strain. It's very commonplace to have cannabis flower sold in the dispensary system to test anywhere from 17 to 35% with THC potency with upwards of 3.5% terpene profiles. Now, I keep talking about cannabinoids, THC. There's about 120 different cannabinoids. THC and CBD are the most widely known and prevalent cannabinoids. There is a whole host of other cannabinoids that in the next slide I will show you, but one of the reasons why cannabis seems to be such a popular approach, especially to pain management, is because of this entourage effect, right? The entourage effect is really this theory of having a full spectrum of the cannabis plant that works together. So that's why flower is something where in its natural state, patients really love the strain specificity of cannabinoids and the flavor profiles through these terpenes or compounds that are naturally existing in the flower form. Next slide, please. So as a takeaway with this presentation, I wanted to just show kind of the cascade evolution of different cannabinoids. In the flower form that I showed you before, those crystals are THCA crystals when it's raw. When you heat it up, it becomes THC. And it also and I don't want to say degradation, but typically as it ages, you will have some conversion to end products like CBN and Delta-8. Now CBN, because there's a lot of less well-known cannabinoids that have been found to have therapeutic effects. CBN, we're finding, especially in the formulations we're using, is having really excellent effects with sleep. And so patients genuinely are choosing this, this product type, formulations that have CBN for insomnia. If you can go back, slide 13. There you go, next one. So this is just another quick takeaway for your own reference, courtesy of Elemental Wellness, with the therapeutic effects of a wide variety of these cannabinoids. Next slide. Okay, so I was saying before, within the dispensary system that flower still represents the majority of sales, anywhere between 50 and 60%, but there are other products, and those are manufactured products, more specifically concentrates and cartridges that are becoming even more popular because of ease of use, the potency attached with these more pure forms of oil, and a level of discretion that a lot of patients are favoring. Next slide, please. Now, Hawaii State allows for a very wide variety of product types. Transdermal patches and pre-rolls have been approved as manufactured products and that are not listed above. But what I did want to show are the nuances between all of these different varieties of products that your patients may be utilizing, especially if they're kind of dialing into the dispensary system. And when you start getting into the nuances of like live rosin, live resin, non-live BHO, these are terms typically associated with like recreational use, for example. But that was probably one of the biggest things as a healthcare provider that I needed to suspend my judgment of what I thought was medicinal application versus more of a recreational application, because for so many years, patients here accessed what was available to them. And I can tell you one clear a time where we had a patient that came in his 70s, early 70s, in a wheelchair, and he was asking for cannabis oils. And it was because his nephew had been able to produce these oils for him for such a long time that it was his preferred method of consumption was through these high potency oils for pain suppression. And in that moment, I really, especially as a pharmacist, I understood for the first time the medicinal narrative attached with, and this is what they call it, dabbing. So the biggest issue that I had was with the nomenclature. Now, these are not clinical terms that we're using. Some of the strain names, you know, are you know, very, it feels more recreationally, recreationally inclined. But I will say that once you kind of get past the fact that some of these names are what they are, and it's not clinical in nature, and that there is a therapeutic use for these high potency oils that people have been able to access for years, you know, you can actually get to the point where you can have more of a holistic discussion with these patients and understand that regardless how somebody's accessing it, regardless if it's a medical program or an adult use recreational program, the standards attached to having clean tested medicine should be the norm for anyone consuming, because like I said, patients may be registered, but there are also patients that are not registered. And it may be because they have a firearm and because they don't want to be in the state registry program. Does not mean that they're not using cannabis as a medicinal product or as a therapeutic application. So, you know, that was one of the key takeaways. Thank you. Next slide. So concentrates, as I was talking about, has become a popular option for pain management due to higher potency oils with various consistencies. Concentrates are typically vaporized at lower temperatures versus combustion of flower when somebody's smoking it at lower potencies of cannabinoids. THC dominant cannabinoids, and it's really, oils represent THC dominant cannabinoid in its purest form. CBD is a therapeutic alternative that can be found in the same products of various ratios. So you don't have just a THC dominant product. That could be the most dominant terpene, dominant cannabinoid, but you can also have different ratios of THC and CBD together. And so one of the things that I wanted to leave you with when it comes to CBD are the potential drug-to-drug interactions, because CBD is more widely accessible. You don't have to access CBD through the dispensary system. You could, and that's where you would get that entourage effect with the THC, CBD, and terpenes. But CBD is widely available in tincture form, as a topical and as ingestibles here in the state through the hemp program. That seems to be a very popular option for patients as well. So what I have listed here are just some takeaways. If you're in practice and want to understand the implications of CBD with the CYP 450 system, I have some slides here referencing some studies for your use. And thank you so much. We're at the end now. Thank you. Thank you so much for your patience. I apologize for the technical difficulties, and I'd love to answer any questions that you have.
Thank you so much, Dr. Moore. Any questions for Dr. Moore? Dr. Cohn, did you want to ask her about touching on any negative effects of medical cannabis?
If she has the time, and I don't know that we have the time, and it's kind of off topic for this discussion, I think. So, I mean, certainly interesting, but I'm not attached. So, thank you.
Renata,
So-
oh, sorry, go ahead.
No, I was just gonna say, it's interesting with the side effect profile of medical cannabis. Yes, the psychoactivity component of it is something that especially cannabis naive patients need guidance navigating through. I think this is where maybe starting with a 1-to-1 ratio of THC, CBD, and kind of building your THC potency as needed based on the indication. And I'm tying this back to pain because, as I showed in one of the first slides, like over 80% of patients are registered patients because of pain. And so that's where the emphasis on higher potency THC comes from. And you do worry about psychoactivity. We have had patients who were in that 65 to 75 age demographic consume, one patient in particular that I'm thinking about that did consume a higher quantity or higher potency THC capsule. And at the end of the day, they got through it and they had to remind themselves that there was not a lethal dose for cannabis that they had to worry through. So essentially they were on a ride they couldn't get off of for about 4 5 hours. You have to be able to walk yourself through, maybe take some, there's a kind of like they call it a high stopper or an antidote, and that would be, CBD. CBD really helps mitigate that psychoactivity. And in addition to that, there are certain terpenes like beta-caryophyllene that you can find in black peppercorns that can also mitigate the psychoactive effects. So sometimes we are also recommending to patients to chew on, some black peppercorns and have some CBD on hand to help mitigate that. But at the end of the day, it's about starting low and going very slow as you're titrating out in potency. But psychoactivity seems to be the most prevalent, I'd say, side effect that is most uncomfortable for cannabis naive patients.
Wendy, you have your hand up?
Yeah. Thank you, Jaclyn. That was very interesting. Would you please speak to strategies to avoid drug-drug interactions and side effects, such as like spacing doses or using CBD dominant cultivars?
So this is where, one of the things that we're trying to do as a licensee is we work a lot with the UH Pharmacy School and educating pharmacists at the point of dispensing other types of medications to have certain interventions, I'll say. And so when they're coming to the dispensary system, it's hard because we don't have a full medical profile on them, right? So it's very basic information that we're able to provide. I do believe that these strategies and interventions are best either at the point of, prescribing other medications when you know that a patient is on medical cannabis, or even patients have a lot of open and transparent dialogue with pharmacists, and really having pharmacists be able to navigate through some of these conversations. So you can space out. It's just so dependent on the medications, Wendy, and the conditions, and how they're metabolizing, how sensitive they are. But I mean, I would say that you're utilizing similar strategies that you would for other drug-to-drug interactions.
Great, thank you.
Thank you. Dr. Martin?
Hi, thank you so much for the talk. Robin Martin here at Psychiatry on Oahu, and I'm curious. There was just a provider on the North Shore of Oahu, Kara Wailua, that was shut down by federal law enforcement, and I'm wondering if you could comment on that, and if that, the changing legal landscape and how that may affect patient access.
Thank you for asking that question. It's really interesting. it's been quite some time since the state has seen any kind of federal intervention. For the longest time, you know, we had something called the Cole memo, which really outlined the way that the federal government, or how you would have to operate in order for the federal government not to intervene. And essentially it's by following, you know, state regulations and laws. And so because that's a different structure than the structure that we must conform to, it's really hard for me to speak to why that actually happened. But what I can tell you is, from a patient access perspective, I'm sure there are going to be implications. My understanding is that there were, 1,000 patients at least that called that location, their grow location. And so I do think that there will be some displacement of patients in this short-term period. Again, caregiving and having somebody to grow on your behalf, if it's a trusted source, I mean, this is something that patients have been doing here well before the dispensary system ever came online, right? So I'm sure that, long story short, I don't know what the cause was for the federal intervention. As I said, that's kind of an unfamiliar regulatory environment than what we have to conform to. But it seemed severe enough where it was a total seizure of plants and other things. And what we do know, which is unfortunate, is that there is some displacement of patients.
Thank you.
Thank you. Thank you, Dr. Moore. We do have a couple another question in the chat, but I know we're right at time and we want to be respectful of everyone's time. So if you have to drop off, thank you for joining us. And just a quick question that we got in our chat: if someone were to chew on the cannabis, are the effects different?
Based on how, yes, excellent question. So based on how you consume cannabis, your body metabolizes it, and the effects are very different. And so there's so much to cover when you talk about cannabis as a medicine and its therapeutic application. That's probably for a whole nother discussion, more clinical oriented discussion. But yes, it does vary based on the method of consumption and the way your body is metabolizing it.
Great, thank you. Thank you again so much for being here. Lots of mahalos and thank you in the chat. So please be sure to check that out. I will post a PDF version of Dr. Moore's slides, as well as that video link on our resource page, and a link to their website as well, with her contact info if you folks have any questions. And again, please be on the lookout for our upcoming instructions on how to change over to our new platform starting in January 1st. So thanks everyone. Have a good rest of your week. Thanks again, Dr. Moore, and thank you, Nurse Wendy, for being there to help out on some of our Q&A in the chat. Mahalo, everyone.